We're back down at the Douglas Vaccination Hub here at Chester Street, and we're not going to show people, but there's certainly a lot of action. People are sitting there waiting their turn. This has taken a while here. You're looking pleased. I'm guessing that the pickup seems to be in quite a good turnout here.
It's phenomenal. We're getting a huge amount of throughput through. I've just done a tour of the facility. You didn't realise when it was the supermarket just how big this space is. It's absolutely massive. And in fact, even on the tape, people will probably be able to hear the echo in the place. But there is lots of people flowing through. We're getting the vaccinations done quickly and efficiently. I'd like to thank everyone involved in this, from the project team who helped design it, to the staff here on the ground doing both the administration and the vaccinations themselves. It's a real phenomenal team effort that's pulled this together for the Isle of Man.
Now, there's always going to be somebody carping, and in fact the only thing I can think of that people say it's almost over sort of done, you know, it's got bounce trays and all the sort of finishing, but this is definitely temporary, right? This is not a long-term thing here.
No, it's temporary for the period of the vaccination programme, but we've got to remember this is a clinical space, and I'm always a firm believer as Minister, if you're going to do something, you do it properly. There's no flimsy setup here. It's a proper setup with 10 booths, proper clinical booths that can deliver the vaccine swiftly and efficiently to people.
And will you ever reveal the cost of this? I know you're a bit worried about that in questioning so far.
Yeah, no, I'm not worried about it. We will reveal the cost. I don't like giving ballpark figures, you see, until all the add-ons are added on, because that just produces questions saying, well, you said that figure before and now it's gone to this. Once we've got the final figures, they will be publicly revealed, because this is capital schemes, as is the airport, so they're there on public record.
Should we quickly talk about Ramsey? The pop-up is now only a pop-up. You were talking about having a proper hub at one stage. That's gone off the ball?
Well, no, we
never
need to be clear. The Ramsey Northern Hub was always going to be a clinic, because it was always going to cater for those who couldn't travel or couldn't do anything elsewhere.
You were looking for different places, so it sounded like you were making a sort of like, I was thought the courthouse, something like that would have been the obvious place like this in Ramsey.
Well, one of the things we didn't know when we were looking at things for the north was how many people couldn't travel. So we had to make contingency plans looking at larger spaces if there was a large cohort of people, because what you wouldn't want to do is design a pop-up clinic that's capable, say, of having a throughput of, say, 100 people, and then find you've got 200-300 that actually needed it. So what we did was we built the space and we built the programme around those who couldn't travel, and the numbers were actually lower than we potentially suspected.
And is it people in Ramsey will go to Douglas, or could they be going to the airport? I mean, there seems to be, and vice versa, Douglas going to Castletown, or will it be logically thought out?
There will be generally logically thought out. There will be occasions, though, because of appointment bookings and demand for the vaccine, because let's not forget we're doing it by age cohort, so you're talking about 4,000 or 5,000 people at a time by age cohort, so there will be occasions where people in Douglas may have to go to the airport based on the booking slots, but they will be few and far between. We will, wherever possible, try and do people by geographic location, but we do have to accept that on occasions that won't be possible.
And just like a Ramsey, people will be able to get done locally, in the sense maybe GP surgeries eventually, or is that definitely happening or potentially happening for people who can't travel?
Well, people who can travel, who can't travel, should be able, if they're in Douglas, to be able to get to this hub, Paul. I mean, it's not that far a distance, even from the top of Douglas where I am. There's plenty of bus services, etc. The same as we would expect people who can only travel a short distance, say in Castletown and Walloon, to be able to get to the airport hub. It's the other regions, such as more the north, where we're looking at. We've also got the programme to be able to vaccinate those who are housebound as well.
Now, we didn't do you last week for my questions which are here, so I'm going to do another part here. I know you're a very busy boy, but we missed you last week. It's just the way it went with COVID,
we tried twice. Monday something came up, so I had to cancel. I postponed it to the Thursday for you, and then the Council of Ministers meeting went on. So we can do it right now and combine everything up.